we will start this day with a keynote address, and we will be listening to a dear friend of SDGHI, of the Global Mental Health Program, of the Planetary Health Initiative. She is a wearer of many hats, and she's literally wearing a hat now. Yesterday, who among you went to the workshop organized by the Hush Tea Bar? Anyone? I'm seeing some hands being raised. So you're meeting this morning the founder and CEO of Hush Tea Bar. Another hat that she's wearing, she's the chair of the board of directors of Workwell Leaders. Okay. We also did a workshop. You have many workshops in this conference. She is also a former nominated member of the parliament here in Singapore. And I would like to describe you as Singapore's champion of climate change and mental health. So without further ado, let's give a big hand to Anthea Ong.
Thank you. Okay, I may need some help to switch to, thank you. Good morning, everyone. As we prepare to switch over, I would like to be, it's a small room. I was thinking it might be bigger. So I've prepared Mentimeter, so there's a little bit of interaction. But, during my sharing, if you feel like you want to put up your hand, see, even my voice don't need a mic. Just shout and we can have a conversation. Okay, so if you can take out, I know Renzo said to disconnect to connect, but could I ask you to, I think in the spirit of mental well-being, we should start off with, how are you today? No wrong answer. So I'm glad that you're just saying what's coming up for you. That's really important. Great. Okay, I was told I have to be near the mic because we are recording. Then I better not speak too loud, otherwise I might burst your eardrums. Okay, good. Everyone's hungry, excited, a little tired. All right, so thank you once again, Anne-Claire, Renzo, for having me here. Just the fact that we've dedicated a day to talk about the intersection of climate change and mental health speaks volume of how far we've come. But it also presents such an immense opportunity for us to work together to shape an enlightened future for both people and planet. As I stand here, I was actually recalling that the first time I spoke about mental health and climate change together was pre-COVID, 2019, during the budget speech in Parliament, when I urged the government to not push these two profound challenges to what I call the important but not urgent bucket or the quadrant, right? For those of you who knows the importance urgency matrix. Let's just say that at that time I wasn't really given much attention. This was pre-COVID, but that really got me thinking that, wow, that's how far we've come, right? And I said that we shouldn't push it into that important unurgent quadrant just because these issues are invisible. And that, I think, is a tendency of all humans, not just governments, right? That we tend to go to what is visible, what is tangible and before you, in terms of the fire that needs to be put out, not actually taking care of the smoke that is in another part of the area. And so I took it upon myself in the 2.5 years that I was a nominated member of parliament to make sure that these issues were more than visible to the government. And for those of you who are not from Singapore, Nominated Member of Parliament is a uniquely Singapore parliamentary innovation. There are only 9 of us in every parliament session who's appointed by the President of Singapore out of the 103 MPs in the chamber. And our role really is to be able to speak out on issues that affect the nation without fear or favor, because we are not voted in. Okay, so again, in this spirit of well-being, I thought, and also going with what Renzo said about disconnecting to connect, how about we actually do a little bit of centering practice this morning to present ourselves. So can I invite all of you, if you're called to it, you can close your eyes. If not, totally fine, but soften and lower your gaze. Those of you who attended the workshop yesterday at What Well Leaders, we did the same thing as well. I'll just share with you that that was also what I did on my maiden speech in 2018 in Parliament. I was ball of nerves because I know I was breaking a lot of the standing orders in Parliament to get the entire cabinet and backbenchers to breathe, but I did. So let's do this together. So close your eyes, I'll be doing that as well. But again, if not, soften, lower your gaze. Keep your feet firmly on the ground. Make sure they're parallel to each other. And if you don't want to close your eyes, you can just stare at this amazing picture to just allow you to get into that sense of peace and calm. To sit comfortably, allow your buttocks to sink into the chair. Relax your shoulders. Keep your spine tall and straight. Completely relax the skin on your face. Keep your head exactly in the center of your spine. As you start to still your body, to center your body, you'll notice that you're also centering your breath. Now bring your attention to your breath, taking a long, deep inhalation through your nose, and a slow, complete exhalation through your nose, feeling your body relaxing. And one more breath as you inhale, feel energized. As you exhale, feel your body relaxing. And just take a moment to visualize a place of nature that's a favorite go-to for you. Where is that place? Is that a forest, a beach, maybe a garden, where you are by your favorite flower? Let your awareness settle in this world that you're visualizing around you. And listen to the rhythm of your breath. In and out. And now when you're ready, take another long, deep breath in. As you breathe out, slowly, gently open your eyes. Welcome back. It really puts us in a different space when we come together, not just in person, as we are in this room, but also in presence. And I hope that allows us to connect more with each other. So as I stand here, it's really hard to believe that it's been nearly 2 decades since my perfect colossal collapse as a CEO, from a broken heart, a broken marriage, a shattered career and financial ruin. It's not a sob story, I'm here. But it still feels really surreal that healing journey from that deep, dark place led me on a very unexpected trajectory into a life as a full-time volunteer, or what I call full-time human, part-time everything else, and more specifically as a social entrepreneur and change maker. And then that got me to Parliament, right? I mean, who knows that would have happened. And that parliamentary platform really allowed me, with the lived experience that I had, to be a fierce advocate. And I really mean fierce, sharing with some of you. I was relentless because this was pre-COVID. Mental health really wasn't a priority at all. And so because of speaking about mental health with every bill, in fact, I spoke at every sitting in that term, and doesn't matter whether it was the employment amendment bill or the electronic payment services bill, I was going to find a way to talk about mental health. And I remember a fellow MP asked me, Anthea, how do you manage to find a way to talk about mental health? And that's when I said, because mental health is beyond the absence of mental illnesses, right? It's actually everything we do, especially in the highest hall of the land, in terms of making policies and laws, actually affect the mental health and well-being of everybody, right, in this country, and actually also beyond. So I spoke much about, where mental health is concerned, I spoke much about the vulnerable populations like LGBTQ, disability community, migrant workers, all of which, if you think about it, for those of you who understand how politics work, they're not the most politically advantageous topics to, or minority groups to bring to get you votes. So it was really wonderful to have the non-partisan platform of this scheme for me to talk about it, again, without worrying that I'm not going to be able to, get the votes, right? It's not to say that I didn't get some hate mails, though, I have to say, because of some of the topics that I raised. But it's okay. It's all part of the course when you are an advocate and you are sharing, some of those important issues with the nation. So that was pre-COVID, and I was fondly called a troublemaker by certain backbenchers. I was called a troublemaker fondly in jest by some cabinet ministers. But all in all, COVID came and I felt a tiny bit vindicated. Because a lot of the sharings, in pushing for mental health care to be made more affordable, accessible, and to make sure it's also quality mental health care in the public system that would actually be on par with Singapore's world-class healthcare system. That has been really speed up, right, since COVID. And those discussions that we've had pre-COVID has really helped to shape those policies. Also about making mental health education compulsory in schools. I'm so delighted to tell you that since January 2022, all schools, primary and secondary schools in Singapore are have to have mental health education for each and every one of the students. And the same goal for removing discriminatory practices like asking a job applicant for their mental health history. That was also deemed unfair and discriminatory in January 2021. It all came after I have left Parliament, but that's not the point. I wasn't expecting it would happen when I was there, right? I didn't have that kind of power. But it's just been such a heartening experience. But 4 years in the pandemic later, since I stepped down from Parliament when I finished my term, as Anne-Claire was sharing, mental health remains, an urgent and profound issue of our time. And I would say maybe even more dire because it was exacerbated by COVID. COVID did not make mental health a new problem. It was always there. It just made it a bigger challenge. And in Southeast Asia alone, 1 in 7, or about 260 million people. So in our region, that's the number of people living with a mental health condition. And many, and I'm sure you know this, many of them don't receive the support they need because of stigma, because of lack of access to help. And this is, of course, according to WHO numbers. Suicide is among the leading causes of death worldwide. This is something very close to my heart because in the deep, dark place I talked about, I actually did not know there was a term called ideation, but a fleeting thought, an unsafe thought did come to me. And so it's close to my heart. And last year, because we thought that the government is so busy with dealing with so many things, we brought the community together to create the first national suicide prevention strategy in Singapore and present it through the research that we've done in partnership with NUS Saucy Hawk School of Public Health. And we presented that to the government. So that was really a sort of a public-private, so to speak, or public-community partnership that we did. So yeah, and I think what is more concerning is that it is a leading cause of death, as we know, for young people around the world in terms of suicide. In Singapore, 1 in 3 young people between the ages of 18 to 35 had reported depressive symptoms and anxiety and stress. So that's every other 3 young person. We also know that dementia is a growing concern in Asia, with the region having the highest number of dementia cases globally. All right. And yet, despite, I think, this staggering statistics, mental health is still often treated as an afterthought after economic growth, physical health, and national security. So we finally in Singapore launched, the National Mental Health and Wellbeing Strategy in September 2023, 3 years after I left Parliament. I must admit, when we had a parliamentary debate on the National Mental Health motion, I definitely felt FOMO for not being in the August chamber. But I was delighted that actually more than 25 MPs actually spoke up to debate and push for more to be done. It's not perfect, but it's the first time we have a coordinated framework for action and policies in Singapore. So that's really very heartening. I think as Anthea shared and Renzo had alluded to earlier, over the last 2 days, we've heard much about going beyond crisis intervention, right, towards a full spectrum of care, from prevention and early intervention to resilience building and community-based well-being. So I think we all agree that healing happens in ecosystems of care, right? It's not in isolation when it comes to well-being. So from workplaces that prioritize psychological safety, which is why we came together to start Work Well Leaders, to schools that nurture emotional intelligence, to policies that integrate mental health into broader mental health and social systems, we really must create conditions that we don't just survive, but thrive. So it's why I'm advocating today for a concept I would call mental wealth. We talk so much about health is wealth, right? And the narrative around mental health, much as it's well-intentioned, first it came from a place of crisis, illness, disorder, and that's entrenching further the stigma, especially in Asia because of the cultural tendencies. And then we now talk about mental well-being, which, people are feeling like, oh, what's that, But wealth, I think it's very straight to the point, especially helpful in a region which is going to be, building more wealth. We are actually going to be one of the fastest growing regions economically. So I hope that then help us to change a little bit of that narrative. Mental wealth isn't, as I said, about avoiding mental illnesses, but it's about investing in our mental fitness, our emotional resilience, and the well-being, more importantly, of our communities. It's therefore about nurturing the ecosystems that support us to be well and flourish. Now you must be wondering, how am I just talking about mental health? Because I want to start with mental health, then we talk about climate. And then how do we bring together as a sort of bring together and wrap up for my sharing today. So, sorry. And I think this journey of healing I shared about, and this, we talked about mental health, really is what led me to found Hash Tiba as a social enterprise, because silence was such a big part of that healing. And silence in the form of meditation, reflection, journaling, walking in the park, just staring out into the sea. That's what I mean by silence. And this helped really in terms of bringing our deaf and hard of hearing friends to be the silence experts and to bring this to workplaces and communities and schools. And so that we are introducing moments of creating mental fitness, even if you are a thriving executive working in a workplace. Don't wait until you're hit like I did. I was thriving as a CEO, and then life just hit me all at the same time in a perfect storm. And then you go from thriving straight to crisis. And so we're hoping that this would, and so I'm really pleased that for the last 10 years since we started Hush Tiba, we've actually hushed 22,000 working executives just in Singapore alone. So it's been just, incredibly humbling to do that. So building mental wealth through emotional restoration and growth is really what we hope we can change the narrative. But I want to be honest, mental wealth concept just came about 2 weeks ago when I finished an article for Straits Times to try to introduce a new concept. Alden was sharing what is unique here. And okay, Singapore is known to be a wealthy country. So I thought, okay, we'll be unique. We'll come up with a mental wealth narrative. But while we work towards, of course, thriving individuals, we must work towards, sorry, I'll share that later. We must ensure a thriving planet, and that's why we are all here, right? But sadly, progress regarding climate change, which is, as most of us would know, SDG 13, Sustainable Development Goal 13, in the Asia Pacific region, we're found to be regressing alarmingly, in 2023 by the UN Economic and Social Commission. Apparently, the region currently contributes more than 50% of the world's heat-trapping GHG emissions. We are still struggling. We only have 13 out of 29 Asia-Pacific countries, including climate change, in their national statistics plans. Right. So, I mean, there's a whole host. I don't want to go into this like, oh my goodness, we're doing so poorly. In Singapore, those of us who are living here, we are already experiencing the effects of climate change, rising sea levels, a big part of the commitment by the government towards that, change action to building extreme heat and increased climate-related health risk. The heat stress is real, especially because of our weather, but more importantly, because we have such a huge population of migrant workers in the construction sector and the process industries. Across Asia, the stakes are even higher. The floods in Pakistan, as we know, droughts in India, and typhoons in the Philippines are not just environmental crises, they are humanitarian emergencies, deepening inequalities, and displacing millions, which Anne-Claire alluded to. So for me, from advocating for zero waste, a master plan in zero waste in tackling our food insecurity, especially amongst the vulnerable population, to building a climate resilient banking sector in Singapore, and also proposing tax reliefs and incentives for a carbon neutral economy. I was delighted when the Singapore Green Plan 2030 was finally launched in 2021. Already a vegan and a public commuter. Between being a vegan and public commuter, I have to say that giving up my car for 25 years with a lot of convenience was actually more difficult, which was very strange considering how small the country we are. But it still hit me hard, right? When I went to Antarctica on a climate change expedition with 2040 Foundation based in New York, which is advocating for the continuity of the Antarctic Treaty, which is coming up for negotiation in 2040, just so that we won't have countries rushing there to extract more resources from the last continent of the world. It still hit me hard when I saw the melting ice shelf, right? It really did not, it was very visceral as well. Never mind, it was obviously icy and freezing. But it was very visceral to see that this was not just, like I said, an environmental crisis. It has a huge human cost. Antarctica, for those of you who may not know, provides 90% of fresh water to the world. Right, so its melting has big impact on rising sea levels, but also in our access to fresh water. So yes, I think when I was there, in this picture, I was very happy to kiss the ground. That's what I was doing. I was kissing the ground, and my fellow change makers from around the world, like, the penguin just pooped there, and it doesn't matter, it's fine, it just, I just felt so. I felt actually a little bit torn because I felt like I was transgressing also by being there, even though we're very careful and we're trying to we make it a carbon neutral trip with the carbon credits that we contributed to as well. But still, I felt like we were transgressing, but I was really happy to be there. So seeing that before me was visceral, and I experienced some eco-anxiety, right? And maybe a little bit of eco-anger as well, but suddenly climate grief. And I think that's what really hit me. I felt that it wasn't just, the urgency of it. There was a sense of the hopelessness of it at that time. But thankfully, I also had another thought. I mean, everyone was obviously on the boat. We're discussing what to do when we get back and all of that. Everyone was talking about creating climate change and advocacy initiatives. But what came to me interestingly was that, okay, Anthea talked about how environmental crises cause a lot of psychological challenges, and displacement and the stress along with it. But I also think the other way around is true, right? Burnout people will burn out the planet. In social work, we talk about this concept of cognitive overload, right? When you are burnt out, you just don't have that mental and emotional capacity to make the wisest choices or to be even intentional, right? So the other way around is also true. And so that was what on the boat, the idea of work well leaders came. I just thought, okay, we need to make sure that all CEOs of the world actually, number one, they need to take care of themselves because they are actually going to be driving the sustainability agenda, including for the people, not just the planet. But they must also create an organizational culture through their own behaviors, healthy behaviors, and human-centered leadership values to create that, that drive and an action-oriented, culture towards sustainability. Right? I mean, can you imagine if you're so stressed out and you're told that, oh, please don't use, a paper cup. You're like, really? I'm just struggling with so many challenges. So I think that's important to have a supportive culture, a leader that's enlightened and is well. And so at Work Well Leaders, we call it, we call it eco-empathy, that we have to create that eco-empathy so that we go from eco-anxiety to eco-empathy, whether it's in the workplaces. Now, the workplace is a very important part of our effort, whether it's for mental health or climate change, because 70% of adult, well, in Singapore, but I dare say that thank you, is there for most places, they are working population. Right, so it's the organized structures of workplaces that we can use to push for some of those changes in behaviors and mindsets. And so eco-anxiety to eco-empathy with action, And this is what we're trying to do with Work Well leaders. Right now, it's out of Singapore. It's a registered charity. Recently, we've just been awarded the Institution of Public Character, which means that we can raise funds and you get tax deduction. But we're held to a higher level of governance. The idea is to bring CEOs together to make change through workplaces. And I think that would then allow the trickle down and trickle up effect, because the working population really is the proxy of caregivers for the young and the caregivers of the old, right? And then if we can start changing the conversation. Okay, I better get going. All right, this is me. So now, when I reflect on this twin crisis, right, mental health and climate change, I see a profound truth in it. The way we treat our planet mirrors the way we treat ourselves, right? We can't protect what we don't love or have a connection with. A world that burns out its natural resources is the same world that burns out its people. The exhaustion we feel individually is a reflection of the unsustainable systems we have built. If we want to heal the planet, we must also heal ourselves. And I think for me, the healing has always come from nature. As a little girl, when I was bullied, I would actually climb up the trees and sought refuge there. And then, 30 years later, when I had that crisis, I went hugging the tree again. And I've been hugging a tree every week, every Sunday after my run. So I'm heartened that, I want to share some of what we're doing in the intersection in Singapore. The Singapore Green Plan 2030 recognizes the importance of mental health and well-being, particularly through initiatives promoting access to green spaces. Similarly, the National Mental Well-being Strategy recognizes nature-based solutions, including 30 therapeutic gardens across Singapore by 2030 to provide restorative spaces for people with various conditions, including ADHD and dementia. Building codes now prioritize occupant well-being with the Green Mark certification scheme and the Building Control Act, playing key roles in promoting sustainable and healthy building designs. Last September, Singapore also announced that its WHO-certified emergency medical team would be the first in the region to include a clinical psychologist, not just for disaster casualties, but also for the staff involved. And I shared earlier the intersection of mental health and sustainability within the ESG framework, which is environment, social, and governance framework. It's becoming increasingly critical for businesses because investors are placing greater emphasis on that. Legislative levers and interventions are demanding compliance to that. So we are starting to see the intersection of mental health and well-being. Now, let me finish by making a call to action and thriving together. So I would like to ask all of us here, how do we ensure that mental well-being is integrated into climate policies, disaster response, and urban planning? How do we scale community-based solutions that address both emotional and ecological resilience? How do we equip young people here, not just with the tools to cope with eco-anxiety, but to move towards eco-empathy and with the power to lead climate change? And how can we, especially for this, and Claire and Renzo especially, how can we push for more research, especially innovative research that explores the intersection of mental health and well-being? No one has the answer, but everyone has part of the answer. So today's conference, I think, is an opportunity for us to build partnerships across disciplines, across generations, and across borders in shaping this enlightened future, as we talked about. I would like to do a shout out, especially to the young people. Your voice matters. Your determination to create a just and sustainable future. Some of the young people are smiling. It's the most powerful force we have. You are not just inheriting the world, and I'm sorry we have given you a world that's actually in a pretty bad shape, but you can shape it, and I want you to shape it. I hope you can shape it. And to all the policymakers, let's craft solutions that integrate mental health and climate as deeply intertwined. So last but not least, rush a little bit, got carried away. So sharing all of this, what is the one personal action that comes to you that you can take today to improve your well-being and your relationship with the environment. At Work Well Leaders, our rally cry is be well to lead well. And I would say that is be well to also live well, to love well. So what comes to you? And it doesn't have to be big, as Mother Teresa said, right? We cannot do all do great things, but we can all do small things with great love. I'll share this with Renzo and the team, and then maybe this can be shared with everybody. So you get to see as a community, what we are doing. Remember, we must put on our own oxygen mask before putting that on others. We can't pour from an empty cup. And especially in the work of change making. Wonderful, wonderful. I love that you're promoting nature therapy. Please include me. I love that very much. So in closing, let's build mental wealth with an abundance of eco-empathy, because when we heal ourselves, we heal the world. And when we heal the world, we also heal ourselves. So let's reimagine how we thrive together as people and planet. The challenges obviously are immense, but so is our capacity to change and action. All right, shall we do a last checkout? And then I wish you all an inspiring and illuminating day ahead as you discuss these issues. And I hope that together we can have Asia lead in this area of intersection between mental health and well-being. And let's come together to be the leader. Yes, great, great. Still hungry, but okay. Inspired and hungry is good. Instead of, yeah. Thank you so much for having me and for listening and for being so engaged. I appreciate all of you. Thank you.